my name's Mariah and I'm going to be talking to you about diabetes and blood sugar monitoring. Diabetes is a serious disease. It's where your body cannot regulate your blood sugars. It may either produce too much insulin, causing low blood sugars, or not enough insulin and results in high blood sugars. Diabetes affects every system of the body, including the circulatory and nervous system. Some of the effects of diabetes are system failures. Your kidneys can shut down. I already mentioned circulatory, where blood's just not getting to your extremities the way that it should be, which could result in limb amputation. Your wounds don't heal well. And ultimately, diabetes can lead to death. When a person is determined by their doctor to have diabetes, he will decide what sort of monitoring the person needs. It may just be a blood sugar A1C every 3 months or once a year, depending on the severity of the diabetes, or he may determine that you should do monitoring at home as well. And again, the frequency of that will be determined on the severity. Some folks may only check it once a week at home. Others may check it 4 times a day at meals and at bedtime. In checking your blood sugars at home, the doctor will prescribe, he will give you a prescription for a glucometer, which is a machine that reads the blood sugar level in your blood. When you're checking your blood sugar at home, the first thing that you should do is wash your hands, have a clean area, and gather all your supplies. Your supplies would be your glucometer, the strips that go into the glucometer to read the blood sugar, lancets, which are tiny pins that you use to draw blood, the lancet pen, which if you're lucky enough to have one, makes it not quite so painful, alcohol swabs, and cotton balls or a Band-Aid. The first thing you want to do is prepare the glucometer by inserting the strip. There's many different sorts of glucometers. Some have a disc and you just kind of flick a switch and the strip comes out. Others, you put the strip in. Depending on which one you want to get that strip into place. When it's ready for the blood, it usually will say apply blood, or it will have a little droplet indicating that it's ready for the drop of blood to go on. You want to prepare your finger first by massaging and putting it in the downward position. That helps get the blood flowing a little more. Once you've checked your blood sugars, especially people who have to check it 4 times a day, the blood kind of gets hard, like you've tapped the well out and there's no blood that wants to come. So massaging the finger, holding it in the downward position, usually helps get the blood flowing for you. As well as when you wash your hands, if you use warm water, that also helps get the blood flowing. First thing you'll want to do is use an alcohol swab. You'll clean your finger with the alcohol swab, allow it to air dry. Then you will take the lancet, put it into the pen, draw the pen back. Don't press hard. You just want a little prick of your finger so that enough blood comes out to fill the strip. You'll squeeze a little of the blood out, wipe it off with a cotton ball, and squeeze again till you get a small bubble of blood on the end of your finger. Apply the blood to the end of the strip. The glucometer will tell you when the strip has enough blood. It'll do one of a couple different things. One, it may count down seconds. And when it starts counting down the seconds, you know there's enough blood on there. Other glucometers have lines that flash once there's enough blood going on. While the process is working, those numbers will count down, or the lines will keep going to show you that you've had enough. If you don't put enough blood on the strip, or if you put too much blood on the strip, the machine will usually read error, and you'll have to start the process from scratch. When the results show on the recording, you will want to mark the results down onto a log, which will say what time of day, the date, what the blood sugar was. We're not going to talk about insulin, but on that log, you'll also have, if you had insulin coverage, what that would be. The logs are very good because you'll want to take them to your doctor's, and he can just have an overview of how your blood sugars have been doing over a certain amount of time, and then he can decide your diabetic treatment from there. It's very important that you adhere to any orders that your doctor gives you regarding blood sugars. High blood sugars can cause problems. Low blood sugars can cause problems. It's just a very serious disease, and you do not want to get it out of control, and suffer the consequences of diabetes. Thank you.